Okay, so what do I have?
Okay, so you've arrived on scene, or you've been called to an incident from a 6-year-old lady who's complaining of chest pain and respiratory distress.
Okay, so I've arrived at the scene. I've got my appropriate protective gear. Is the scene safe?
He was safe.
Okay, I seem to only have one patient. On nature of illness is that she's complaining of chest pain and difficulty breathing. If additional support hasn't been called, I'll go ahead and call ALS now. And by the looks, she does not need C-spine at this point. My general impression is that I have a 6-year-old female walking in. I see that she's just sitting down, but she is having a labored breathing, so I'm going to do this as quickly as possible and make her a little bit more comfortable as to decrease her stress level. So on arrival, I'm going to introduce myself. Hi, I'm Brianna. I wanted to, what's going on today? What seems to be going on?
Hi, Brianna. I was getting hungry, and I was going to make lunch, and I was going to start barbecuing. So I was prepping up all my food inside, and I finished with that, and I started to go outside because I wanted to grill it. And I was going outside to turn the grill on, and then my chest just started hurting, and it was hurting like so bad that it was making it hard for me to breathe.
Okay, so initially I know that my patient is alert and verbal. She's talking, she's tracking me, she knows who she is, she knows where she is, she knows what's going on. Her chief complaint is that she's got severe chest pain. So I'm going to go ahead and address that during my ABCs. Her airway, I can tell is clear and patent because I know she's talking to me. Her breathing sounds, I'm going to go ahead and kind of take a listen. I'm going to check for her breathing. Do I hear anything abnormally?
You don't hear anything abnormal.
Okay, what about, I don't hear anything abnormal, just some chest pain. Okay, well, let's check her circulation. So I'm going to check both her wrist pulses. Any major bleeding?
No major bleeding.
What about any skin signs?
Skin signs are pale and diaphoretic.
Okay, so, pale and diaphoretic chest pains. I'm going to go ahead and administer some oxygen with a non-rebreather mask at 15 liters per minute. Then after that, I can consider her a patient priority. So I'm going to go ahead and let's get her on the rig. Let's get her going en route to the hospital. Okay, so now I can move on. I'm going to around the rig. I'm going to ask her about. I'm going to get her history. So what happened? Can you describe for me a little bit more? So you were just preparing for lunch? Is that what was happening? What you were doing?
I was preparing for lunch, and when I started walking outside towards my grill, my chest started hurting.
Okay. Does anything make that better or worse? Did you try anything to see if you can comfort that pain?
Yeah, I came inside and sat down and had a cup of water, and that seemed to help a little bit.
Okay, sitting down helps. What about, does it move anywhere? Does the pain is it just in your chest?
I feel like pain is trying down my leg a little bit.
Down your
Yeah,
leg? From your
yeah,
chest down your leg?
yeah. My
Oh,
chest down.
okay. Can you describe it for me? What kind of pain is it?
It feels like a huge elephant sitting on my chest.
Okay. So, and then you said your pain's pretty severe, and about, if we can rate that pain, somewhere between 1 being the no pain at all, 10 being the worst pain you've ever felt, where do you think the severity is for you right now?
I would say the pain is about an 8.5.
Okay, and when did all this start?
This
Like how
started
long
about
ago?
10 minutes ago.
Okay, so 10 minutes ago your pain started, you decided you need an ambulance, and we were already here 10 minutes ago?
Yeah.
Okay. So, well, your pain's about an 8.5. Okay, so what about allergies? Are you allergic to anything?
Nope, I'm not allergic to anything.
Okay, what about any medications? Are you taking anything currently?
Sometimes I take Advil for occasional joint pain.
Joint pain? Okay, well, what about any past history of anything like this going on? Has this ever happened to you before?
Yes, I've had a heart attack 4 years ago.
Okay, were the symptoms around the same?
Yes.
Symptoms were the same. When was the last time that you ate? Did you eat today?
I had breakfast at 7:30.
You had breakfast today? Okay. And we discussed the events leading up to. She was just walking around her house preparing for lunch. Do did you take any Advil today?
No, I didn't take any medication today.
You haven't taken anything? Okay, and then you sat down to try to make it better with some water, and that seemed to help you. Now I think I'll go ahead and start my secondary assessment. So I'm going to ask her if it's okay if I take a look at her chest, do some palpating, see if there's anything else, see if anything is hurting her. Do I notice any other skin signs other than the pale and diaphoretic?
Nope.
Okay, is it moving around into her abdomen, or is it, she have any rashes or anything like that?
Now that you've touched it, you do feel little tenderness in her abdomen.
Abdomen's tough. Okay. Is the oxygen seem to be helping?
The patient says that she is able to breathe better, but you visually see that she's still taking shallow breaths.
She's okay taking shallow breaths. So yeah, let's finish with her BPR. Let's get her respiratory rate and quality. What she's taking shallow breaths. The oxygen is helping her. What's her blood pressure like?
Blood pressure 140 over 80.
Okay, so it's a little bit elevated. What about her pulse rate?
Pulse rate is 94.
Okay. What about her respiratory rate? Since I already.
Respiratory rate is 36.
36?
Yes.
Okay, so that's elevated as well. Okay, now I want to get, so I will continue to monitor her. My impression of her now is that it seems to be that she's possibly having another heart attack. To make her as comfortable as possible, I've given her some oxygen, and that seems to be helping for now, and we'll keep our urgency to get her into the hospital as quickly as possible. So with that in mind, until we get there, I'll reassess her every 5 minutes to check her vital signs and check for any changes, see if any of her skin signs, her paler diaphoreticness goes away or gets any better. I'm going to keep checking her blood pressure to see if she, since it's elevated, if it goes down at all. And then I'm going to also monitor her other vital signs to see if those change very much. Upon arrival to the hospital, I will give a report saying that she isn't allergic to anything. Sometimes she's not on any major medications, though she takes some Advil every once in a while for joint pains. She didn't take any today. Her skin signs are that she's pale and diaphoretic. She has a slightly elevated blood pressure, and she ate this morning. Sitting down and drinking some water helped. The oxygen is helping, though her breaths are continuously shallow, and now she has some tenderness in her stomach, and her pain is also going down and through her legs. And that concludes my medical assessment.